my name is Bridget. I am a registered nurse. I also have a master's degree in nursing education, and I'm currently in school to be a family nurse practitioner. So yeah, school just started. I am so stressed. So I feel you. Okay, so today we're going to be talking about tardive dyskinesia. Some people say tardive dyskinesia, others say tardive. I say tardive dyskinesia. But I'm going to give you some tips to help you on your exam. So let's get started. So the information on this page is purely for educational purposes and is not for medical advice. Okay, so first of all, in order to understand tardive dyskinesia, we need to get an understanding of what is EPS, or what we call extrapyramidal symptoms. So these side effects usually occur from first-generation antipsychotics. And there are 4 types of EPS. The first type is what we call acute dystonia, and that's a sudden sustained contraction. So their muscles get really tight. Usually it'll be of the head and neck. There was this one patient on the unit, and he couldn't even speak. It was, I talked to him, and he like, "Miss, I can't speak right now," because all of his muscles here in his head and his neck were engaged. So that's acute dystonia. Then akathisia is restlessness. These individuals would just be like doing this. They'll just be flapping their arms, and they're not really conscious of what they're doing. It's just this need to be moving, and they're so restless, and they're, pretend this is my feet, they'll just flip them up, flip them up. So it's restlessness and inability to sit still. And then we have pseudo-Parkinsonian-like symptoms. And these symptoms, we call it that because they look like they have Parkinson's disease. And I want to do another video where I explain why antipsychotics cause specifically this pseudo-Parkinsonism. And this side effects will look like the stoop posture, the shuffling gait, the pill rolling, or they'll have tremors. And then we come to tardive dyskinesia. So on your exams, the reason why they love to test on tardive dyskinesia, especially if you have a mental health exam, is because they want you, the NCLEX wants to make sure that you are a competent nurse, that you can identify the worst things that can happen, such as neuroleptic malignant syndrome. I'm talking about psych here right now, not other things, but that you can identify the worst things like neuroleptic malignant syndrome, tardive dyskinesia, and that you can identify it and appropriately intervene. The keywords that you want to look for when you're taking an exam with tardive dyskinesia, and let me move myself up here so that you can see this portion. Okay, so the key things that you want to look for on the exam when they're referring to tardive dyskinesia is uncontrolled movements, involuntary, or bizarre. So tardive dyskinesia happens after someone has been taking antipsychotic treatment for a prolonged period of time. And what tends to happen is all of a sudden they'll start to get these motor symptoms where it'll just be a little bit of a tongue protrusion. So it'll be like, they don't realize they're doing it. It's unconscious, it's involuntary, they don't know they're doing it. So imagine for these individuals, now I am helping you for a test, but I also want you to be better nurses. Imagine you're a nurse and you see an individual that first it starts like this, and the next thing it's like, and they're walking around all day. How do you think that affects their quality of life? Think about maybe when they're trying to get a job. So we want to identify tardive dyskinesia immediately. The reason for this is because with the longer it goes, the worse it gets. It's progressive if they continue taking these antipsychotic medications. So it's progressive, it gets worse, and then the worst part is that it's potentially irreversible. It will never go away. For some, once they stop the meds, the symptoms can get better, but not always. So you want to catch these symptoms when it's a little bit of a tongue protrusion, maybe a versus a, right? So remember, if you see on an exam question, bizarre, uncontrolled movement after a prolonged period of time, you're going to think tardive dyskinesia. And that's where my focus is today. Again, psych is so big and there's so much to discuss, but I like to really pick one topic and stick to it. Okay. So let's go on to the next one. So again, these are the 4, let me see. Okay, so that way you can see all of this slide. So with the pseudo-Parkinsonian, let's see if I can move it here. Okay, pseudo-Parkinson, like I said, they're going to have the stooped posture, shuffling gait, rigidity, slow, Brady is slow, so slow movements, kinesia is movement, tremors at rest, and pill rolling motion of the hand. Akathisia, right here, that restlessness, trouble standing still, paces the floor, feet in constant motion, rocking back and forth. They'll be like I said, or they're flipping their feet around. Dystonia, facial grimacing, involuntary upward eye movement, muscle spasm of the tongue, face, neck, and back, laryngeal spasms. If it's laryngeal spasms, then that can be a medical emergency. But most of the time, you tell them to count, they're like, 1, 2, 3, like they can't. So for them, something like cogentin, benztropine would be a good intervention. Tardive dyskinesia, here we go with the protrusion and rolling of the tongue, sucking and smacking movements of the lips, or maybe they'll be like, facial dyskinesia, involuntary movements of the body and extremities. And again, today we are focusing on tardive dyskinesia. If you need another psych video, I can do another one, but this is our focus for today because I like to keep the videos short, engaging, so that you don't get bored. Okay, why is TD serious? So TD is the abbreviation for tardive dyskinesia. Okay, if it's in red, it's important, right? Potentially irreversible. That's why you need to be able to identify it. It affects their quality of life. It's very sad. It gets worse with prolonged or continued use of medication. It greatly affects their quality of life. Remember, we're not just learning about this in a textbook. People are living this. Put yourself in their shoes and imagine if one day you woke up and all of a sudden your tongue would do this without you knowing it. Right? Okay, so what do you need to know for the NCLEX? Number 1, you need to know how to recognize it. Know the appropriate intervention. So know how to recognize it. Remember, involuntary, bizarre, it'll be either lip smacking or tongue protrusion. And the appropriate intervention is you need to tell the doctor that you've seen it and they need to stop the medication. That is what NCLEX or even nursing tests usually will put on their tests. So let's practice. Okay, so here's an example of a question. A nurse notes that a client with schizophrenia and receiving an antipsychotic medication is having uncontrolled movement of lips and tongue. The nurse determines that the client is experiencing, right? So I kind of have looked, I have several books and I looked through a website, so I found this on a website. So I personally didn't write this question, but as you can see, it has all of that criteria that I already mentioned to you, that I already taught you. So when we read a test question, let's analyze it, right? So this patient has schizophrenia. Tardive dyskinesia occurs as a side effect of antipsychotics. So a nurse notes that a client with schizophrenia, so most likely they need to be on antipsychotics, and receiving an antipsychotic medication, they tell you, is having uncontrolled movement of the lips and tongue. The nurse determines that the client is experiencing, and then we have options: A, hypertensive crisis, B, Parkinsonism, C, tardive dyskinesia, or D, neuroleptic malignant syndrome. So what do you guys think? Now, it's not that hard because since the name of this module is tardive dyskinesia, then most likely it's C, and yes, if you pick C, you are correct. It is tardive dyskinesia. So, and the point that I want to drive home, though, is that tardive dyskinesia occurs with prolonged use of antipsychotic medication, usually first-generation antipsychotic medication. So when you're taking a test, I've known brilliant students that are poor test takers. Analyze the question. We have schizophrenia. They're on antipsychotics. They have uncontrolled movements. Already you should be thinking tardive dyskinesia without even, you're covering up your answer choices. Without even thinking of your answer choices, you say, I think this is going to be tardive dyskinesia. Let's practice one more. Okay. A client has been adherent with olanzapine Zyprexa, 4 milligrams every night at bedtime for the past year. On assessment, the nurse notes that the client has bizarre facial and tongue movements, which is a priority nursing intervention. So in this question, they want you to identify what it is. They're not going to tell you what this patient is having. They want you to identify what's going on. Let's say you're taking a test and you don't even know that you're like, what the heck is olanzapine? I studied my meds, but I can't remember. I have no idea. So let's use test taking tips, right? So he's taking something at bedtime for the past year. What are our keywords? Pick keywords from your question. You note the word bizarre, right? And you note the word bizarre facial and tongue movements and priority. What is the priority nursing intervention? And there was another word. Oh, he's been on it for the past year, right? So there we go, prolonged use. Remember, in mental health, safety is your priority, okay? Safety. I know with med-surg classes, your priority is airway. I know that the ACLS and BLS class changed it to circulate CAB, right? Circulation, airway, breathing. But in mental health, safety is your priority. So you look at the question and you say, oh, this sounds like tardive dyskinesia. What do I need to do? So number one, with the next dose of olanzapine, give the ordered PRN dose of benztropine cogentin. Notify the physician of the observed side effects, place a hold on the Zyprexa, and request discontinuation of the medication. Ask the physician to increase the dose of Zyprexa to assist with the bizarre behaviors, or explain that the side effects are temporary and should subside in 2 to 3 weeks. So what do you guys think? Okay, so the answer is, we're going to, what do you think? Number 2. Notify the physician of the observed side effects, place a hold on the Zyprexa, and request discontinuation of the medication. Why, do you ask? Because, remember, with tardive dyskinesia, it is irreversible many times. So, cogentin only works for EPS, and you can refer back to the previous slide about what EPS is. It does not work for tardive dyskinesia. And if we increase the dose of Zyprexa, the bizarre behaviors are going to get even worse. And the side effects will not subside, right? They will only get worse. Now, if this guy's been on this medication for the past year, number 4 doesn't even make sense. Usually if side effects are going to subside, it's because they've been on a new medication and they're going to get used to it. But it's not going to subside if he's already been on it for a year. I hope that helps. If you have any ideas for any future videos, let me know. I always like to end with a funny meme. So, go to nursing school, they said. It won't be that bad, they said. Yeah, I'm sure you guys are feeling the pain right now. But anyways, thank you so much for tuning in. Like, subscribe, all that good stuff. Bye.